Hello and welcome to Filibusters in Fine Print, where AMGA's public policy team gives you the insider view on healthcare regulations and legislation. Thanks so much for joining us for the latest from Washington, D.C.
Good morning and welcome to Filibusters in Fine Print, AMGA's public policy podcast. I'm Chet Speed, your host, and I'm here with our AMGA All-Star crew. Can you introduce yourselves first? And then I'm going to get to the fact that we're not going to ask a question today, and I'll tell you the reasons why. But please, let's start. I'll start to my right.
Hello, I'm Lauren Lightgate, bringing sparkle and sarcasm as the Director of Government Relations at AMGA.
Outstanding.
Alicia Sawyer, Government Relations Assistant. I got to think about what I bring other than immense support to the department.
Youthful energy.
Youthful energy.
Jamie Miller, Ambassador Goodwill here at AMGA, wearing athleisure, which comes in handy. I'm sure Chet will discuss why.
And we will. So as you all, as our listeners know, we always start with a question. We can't today for three reasons. One, Sharon said we talk too much before we get to the heart of the matter.
How can you talk too much in a podcast?
And that's a good question. I think we talked about the wrong things.
Okay.
I was lectured on that. The second is the AMGA facilities management team let the AC go out on the third floor of our building. It is now 82 degrees, so we're not going to be here for too long. And the third and biggest reason is because Alicia said she has a Hill visit at 12:30 and has to go. So it's like being back at home where no one listens to me and they just do what they want to do. So
She's so forceful.
she is.
Yeah.
Well, I
I'm
guess that's
just
good.
doing my best to support the department.
You know, you're leading the department, which is good. No, I'll say this. I'm glad you've been here for 2 years, and I'm glad you learned some things. Okay, so we're going to talk about Capitol Hill Day today. This was a great Capitol Hill Day. I think it's one of the best in recent memory. There's a lot of energy around the program. The reception started strong. The Hill Day was great itself. And all the comments we got were very, very positive. Just a couple stats to start out. We had 47 total attendees, 30 AMGA organizations attended from 18 states, and we, the team, scheduled over 200 individual Capitol Hill appointments. So our members got to see a lot of people, a lot of members of Congress, a lot of staff, and it was really well done. So I just have a few questions for the team. Why was this year different compared to last? And we'll start with that.
This year, Medicaid cuts weren't necessarily on the table in the same way that they were last year. A lot of the meetings last year were a bit defensive. The conversations weren't as genial as they were this year. The issues that members were bringing to the table, they're members of Congress. They wanted to talk to them about it and learn more. And, you talked about how they had such a great experience participating in Capitol Hill Day. This year in the evaluations and in the follow-up for us, I had more requests for facility tours or district advocacy programs, meetings than in years past that I've participated in Capitol Hill Day.
Yeah, I would say the Hill staff were not as blocked off as they were last year. Now, we're still opposing Medicaid cuts. It's just this year we started with thank you so much for the telehealth extensions, or thank you so much for conversion factor fixes. And we always started with something very positive. And it really helped because a lot of these staffers were willing to listen to us. And it was a better open conversation.
I think it's also different because last year was the start of a new Congress.
Yeah.
So there was a lot of things that needed to get done at a sort of breakneck speed. President Trump really wanted a One Big Beautiful Bill Act passed by July 4th. And so you're going through a massive reconciliation process, which takes a lot of time out of committees. So there's a lot of resource intensive, staff intensive areas that were happening. And this year is a midterm election. So people are running for office, and so people tend to be a little bit nicer to you when they have a primary that's due sometime between now and whenever.
When you met with them.
So I think that also plays a role in it. I don't want that to get lost, as well as people have to be a little bit more sweet to you when they need your vote.
I forgot about that, but you are so right. At the end of the day, members of Congress like being members of Congress, and the staff like to be staff.
Like having jobs.
Yeah, so it's right.
I will say I felt like the energy was different this year. It was so busy. I was in a meeting. We were an hour early, and we messed up the schedule. When we showed up, and the staff was like, "Thanks for coming early. Now I can eat lunch," because he had like 12 meetings that day. It's something about June in general, but I think there's more and more people with the Medicaid cuts and other things happening in the economy. More and more people are coming to DC, so these Hill staffers are very overworked, and but it still means you need to come to Capitol Hill Day. So we appreciate those who did.
Yeah, and healthcare is, we're laying the groundwork for in 26 for what I think is going to be a huge 2027 as far as healthcare policies, actually 27 and 28, quite frankly. So great that everyone was here, because this is when we lay out our agenda, and we're going to move that in 27. Okay, so speaking of agenda, to the three of you who are on the Hill with the members, what issues did AMGA members discuss in their meetings?
A lot around workforce development, because of the fact that it's not just providers that are looking at cuts and looking at the future of what the Medicare, Medicaid workforce looks like, but you also have issues regarding education in terms of our advanced practice practitioners, our nurse practitioners, seeing like gaps there. We have the H-1B visa issue, meaning right now, although that's going to get struck down, like $100,000 fee that is being attached to each new visa when it comes to healthcare, which means that it's an incredible strain that is on healthcare systems and hospitals who are trying to recruit people to work in areas that a lot of our providers don't work in, like including rural and medically underserved areas. Those usually have smaller practices. They're coming in and filling out that role there, which is very needed. And also a discussion of what does workforce development look like in a healthcare system. It's, you can enter in as someone, I was at Princeton this last week discussing at their regional meeting some of the DC updates, and one of the people was there. She started out as a healthcare educator. She's now like VP running like multiple departments within a hospital system. That was sort of economic developments there. Just giving an education in terms of workforce development that is needed, particularly in a time where we're talking about affordability, we're talking about jobs, we're talking about houses, healthcare, medical groups, systems provide the economic basis so people can be active and also have that dignity in work that we also hear discussed a lot.
Yeah, I think, and that's, so for all you listeners, that is an issue that you'll, when you talk to your members of Congress, something to stress is how people do go up the ranks, and there's higher wages, ability to consume products. So the economic ability aspect of what you all do at the individual level is really important, and it isn't really touched on. So something to think about when you all talk to your members of Congress as well.
Yeah, I think Capitol Hill Day is interesting because like we had, I was taking a state that was more conservative, and we talked about different issues like Lauren mentioned with GME and Visa and all these residency slots. And they said, how about I frame this around access instead of money, instead of patients? Talk about access and the dignity of care and making sure that these voters get access to care. And it really worked. We talked a lot about how administrative burden, how certain prior authorization processes take 30 or 40 executives to discuss in a couple hours to go through, and that takes away, that administrative burden takes away from patient access. Also talks about how we have to cut back on the amount of times we spend with patients because we're trying to get through the day. And I think that when this one member from a certain state was just shocked to learn about what a doctor has to go through on a day-to-day basis. I also think one of the executives was talking about access and coverage, and one of the certain conservatives is like, well, there's this health insurance for small business and all those other things, and so we had to teach these policymakers about the term underinsured, which they weren't really familiar with. So I think there was a lot of good opportunities, and as Alicia mentioned, everybody was willing and able to listen and learn, and probably because it was a different year.
Yeah, there was also a lot of conversation on Medicare Advantage, prior authorization, as Jamie mentioned, the challenges and administrative waste that causes, discussion on reimbursement as it is related to ACO plans under Medicare Advantage, as well as risk adjustment. And then, as Jamie mentioned earlier as well, expressing a lot of gratitude for telehealth and using that as kind of an entryway into a conversation where we can then say, hey, and so on the note, Medicaid, that's still a problem for us.
Yeah, and I'd say $1 trillion cut to the Medicaid program is going to be a problem for us for
a long time.
A while. So that is one of our biggest issues. And I'm glad you all touched on telehealth, very important. We have wins there. Let's see, 340B, of course, is being discussed. Was that mentioned at all by some of the members, or?
I was going to say, I heard it mentioned a few times in my meetings, expressing how the funds that those institutions are able to use from 340B, how important those are to maintaining patient access to care.
And willing to work with HRSA and others, but the idea of a drug rebate model coming from the administration is dramatically going to change the timing of the discounts and everything. That could dramatically impact patient care. And I think one of the real big issues with 340B is communicating how this discount impacts access.
Yes,
and that's
exactly.
what our members were trying to convey is access.
There's also lots of talk around AI and its clinical application. AI is kind of like that it girl in a lot of the more urban offices, with more regular, access to internet. Rural offices are more concerned with that than, applying AI. But lots of questions about how our groups are using AI.
I just want to be on the record. I hate AI with my complete heart and soul. So it's out there.
Just make sure it doesn't control your appliances, because you probably turn your oven on or something.
Right against the machines.
My parents, I think they have their oven and their fridge is controlled by the Wi-Fi.
Ooh.
So
Yeah, no, it's not good.
and
We know the movies. We've seen them.
I was going to say,
Matrix,
there's some horror
Matrix.
movies
That was
based
20,
on
that was
that.
20 years ago.
Wall-E.
20 years too soon.
Wall-E.
Okay, Wall-E. That's true.
What's the other one? Idiocracy?
Oh, yeah. Well, that's just.
That's great.
All right.
I hear Sharon somewhere just like thinking, oh no. Move on. They snuck into the middle of the podcast.
Sorry.
We just mitigated it.
You can't stop us. We're going to have our time.
Yeah.
Right now, Claude is frowning.
It's fine. Yeah.
We'll probably get an email.
I know. From Claude.
Yeah.
We had to stop. Okay.
All right. Well, so a lot of action last year, less action this year in Congress. But is there legislation that is beneficial to the members that's out there right now that we support? Things we can rally around, at least this year?
Well, I mean, first and foremost, we've got the Connect Act, which would make telehealth a permanent extension
That'd be great.
for 10 years.
Well, in Congress, that is
As
permanent.
Permanent. Yeah.
Around access, we have a bill to waive the chronic care management code in Medicare Part B. That's HR 8261, and a lot of members, Republican and Democrat, were interested in that because it improves access, and actually for the conservatives in the room, it reduced outlays of the government because you're spending less time in the ER and the hospital and things like that. So you're giving people better dignity of care, the right place at the right time.
We have HR 3890, which is the Resident Physician Shortage Reduction Act, which would add 14,000 Medicare-supported medical residency positions over 7 years. We have a huge gap that's coming sooner rather than later now. I think it's like 2032 or something like that, which is not that far away now.
The Great Wave.
Like so big. There was also conversation around that, right? We're kind of cresting when it comes to the Great Wave, and you're seeing, 10,000 people turn 65 every day, and we're seeing how that hits the healthcare access. And so having medical professionals in place to help with that is going to be badly needed. And I think still that recognition is still needed in terms of our member support there.
Yeah, one of the ironies about Capitol Hill staff is in their 20s.
Yeah.
So they don't need to see physicians.
Right.
It's as you get older when you realize, good gracious, I can't see a cardiologist for 6 months or an ortho for 4 months. And so that's a huge, I'm 61, so yeah, it's a very big issue.
Yeah.
So I'm glad they're addressing that. Interesting, so Fred Horton, who is the president of AMGA Consulting, a lot of his data says that compensation is going up, but only because the existing provider base is increasing their productivity. So they're increasing their volume because there's not as many of them. So at some point, you're going to have a real burnout issue, as well as, frankly, we can't do as much.
Right.
So we need to increase that pipeline, or else we are all going to be in a world of hurt. And as you all say, sooner than later, So I'm glad to see that they're doing something around that.
Yeah, and on the topic of physician burnout, the Prior Authorization Relief Act, that's S3762, that would require HHS Secretary RFK Jr. to complete an audit and standardize prior authorization requirements in MA, and from there go through and remove unnecessary prior authorizations.
Yeah, and a similar bill is just passed out of House Energy and Commerce Committee. So,
Yes.
yeah, it's very good.
Yeah.
And we also talked about HR 3954, Improving Access to Medicare Coverage Act. This is an access issue where if you want Medicare coverage of a skilled nursing facility, you need to be in the hospital for 3 nights. And doesn't make sense because you want people out of the hospital as soon as possible. So we're looking to waive that rule. During the pandemic, it was waived, and certain ACOs it's waived, but we feel like every patient, Medicare patient, should get the same access as skilled nursing facilities.
Absolutely.
All right, great. And we'll have 2 more questions for the team, sort of interrelated. What issues did the members of Congress and the staff, what resonated with them during your visits? And then after that, sort of a tangential question, what do they want from our members going forward? What do they need from us as we advocate for our positions?
Some of the issues that I feel like are bipartisan and something that we've discussed over and over again on this podcast this year is waste, fraud, and abuse. That has come up in any time you're talking about a piece of legislation, you're talking about anything. It's like, well, is there a chance for fraud here? You're like, well, there's a chance for fraud in everything that we do. I'm talking about in human actions, period, not just in healthcare. But that is something that has become sort of a buzzword when it comes to things. I think it's also a way to create a boundary of where the discussion can and cannot go. It's just a bipartisan way of doing it. So I think that is something that has really been resounding with members in terms of like their understanding of how a program works and what is actually sometimes not fraud, but it's just miscommunication or lack of understanding or needing clarification within the rule. If you look at a lot of things that are happening, it's also sometimes it's like, oh, we just needed greater transparency and like clarification on things. And I think that gets mixed up sometimes in the conversation.
I saw a lot of success, at least in my meetings and conversations around chronic care management and waiving that copay, especially when we were, putting it in the context of how it is waste, and that was a really great way to engage Republican offices that, were kind of like, well, why? And it's like, no, it's waste in the system. And immediately ears started ringing a bit more.
Yeah, and I feel like in general, the Republicans were concerned about cost, solvency, even telehealth. They're like, well, that costs money. And we're like, well, it actually saves money in the long run. It's complementary. It complements. It doesn't add the cost. So we actually given them information on that. And Democrats are really concerned about access, and with the expiration of the enhanced premium tax credit and other issues, they're just concerned about Affordable Care Act being dismantled, which it slowly is.
Was it 4 million people who have dropped off the exchanges this year compared to last? So yeah, and that the tax credits, that is a big deal. And I'm sure the Dems will try to reach out to each of those 4 million to make sure they show up at the polls in November. Okay, any requests for Medicaid information? Or,
Especially from the Democrats.
Yeah.
That makes sense.
They're looking for support and evidence for their argument. And so there were a lot of requests noted for like dollar amount costs to the health system or to groups and practices individually.
Okay. We will get that for them.
Yes.
Yes, good.
And a lot of Democrats looking for patient stories and a lot of Republicans looking for data, especially when it comes to Wiser Model and HR1 impact.
And Republicans were not as forthcoming, but interested in the closures. They won't discuss the reason for the closures, but they want to hear about 2 orthopod clinics in a small town. Why is one closing?
Yes.
Or they're Republicans and Democrats are all concerned about consolidation, and so they ask questions about consolidation, and we have a educated discussion about that instead of just pointing fingers.
Yeah, the closure is going to be a very big issue. We've had 2 surveys on Medicaid cuts, and closures come up on both those surveys. And what'll be interesting, of course, is we'll do another one probably spring of 27. At that point, you'll have Medicaid work requirements go into place. I think we'll get a much clearer understanding of what closures and services are being eliminated because of these cuts, because they'll actually have been implemented on 1/1/27. Well, it sounds like it was a great Capitol Hill Day.
It was fantastic. I mean, it's always great to have our members here, not only to be able to spend time with them in our meetings, but like, you know, we learn as we go as well. So to be able to just hear what's happening in their practices is something that I take with me on the Hill, and something that sticks with me, honestly, thinking about like what amazing work that is being done sometimes with very few resources and not enough people.
And I think our members, I mean, I remember the latest stat, Chad, we've talked about how much of the federal government contributes to the revenue of our members. They need to be engaged.
60 to 70%.
And so the members who did come, we really appreciated. Those who didn't, we welcome you to come to DC anytime. We also, Lauren works with our district advocacy program, but being engaged, I mean, it gets us re-energized, but we're always on the Hill anyway. Having someone who's a physician leader come to DC, and it's just good to spread the word.
Yeah, August is a time to invite members of Congress for facility tours. Many of them are up for election and would like to be seen, you know, shaking hands with doctors and kissing babies. And so,
yeah, facility tours are great.
Practitioner 1, 2, 3s do 1 facility tour, 2 DAPs, and 3 grassroots letters by the end of the year, please.
That is a goal and a metric.
Yes.
Maybe we can develop
That I made myself.
Maybe you were just complaining about
Adding
goals.
worked.
administrative burden.
I added my own administrative burden.
Yes, for that we're gonna like 8 KPIs out of that, and there'll be green, yellow, and red
Right.
around that. Okay, on that we can wrap this up. Thank you for the discussion. Thank you for all your work on Capitol Day. Thank you to the members who came, and as Jamie said, next year let's make it even more because engagement is key to supporting our members. With that, we all say thank you very much and have a good day.
Thanks for joining us for Filibusters in Fine Print. This podcast was brought to you by AMGA. For more information about AMGA's advocacy efforts, visit amga.org/advocacy.